This past shift, I was with patient Mrs. Jones, who is a 97-year-old female. This patient is in room 212A, and she's on the med-surg unit. She sustained a fracture of her left hip, and she's 2 days post-op as of now. Mrs. Jones fell, and she was admitted due to this. She has a history of dementia, osteoarthritis, and heart failure, and she's now 2 days post-op, as I said before, with her hemoglobin and hematocrit levels dropping after her operation. So after our assessment, we saw her hemoglobin before going into her operation. Hemoglobin was 10.3, and her hematocrit was 35.1%. And coming out post-op, her hemoglobin dropped to 9.1, and then it was 30.8% on day 1 post-op. And then on day 2 post-op, those levels continue to drop. So we had a 6.9 hemoglobin and a 21.9% hematocrit 2 days post-op. So what I recommend for this patient is, 1, we want to make sure that a spouse is with her, or maybe a family member, because she has dementia and she's 97, just to make sure that she's getting all of the necessary teaching and necessary instructions for her care, because she does have dementia. We just want to make sure that somebody is there to receive this information and make sure she's doing it after she leaves the hospital. We also want to recommend that she does get out of bed and ambulate around just a few times a day. Make sure she gets up. She has a walker we want to use, so make sure she just gets up. Make sure she's not dizzy before getting up, and then put the walker near the bed and just get her up slowly. Make sure she's not dizzy, and then go from there. Make sure we're next to her as well while she's walking, in case she falls, because she does have this history of falling. We want to do that just to prevent pressure ulcers and make sure circulation is going. And even though she did have the hip replacement, we want to make sure she's just moving around lightly. We also want to prevent any infection after she receives the infection due to her hip replacement surgery. So we just want to look for any redness, swelling, anything that looks abnormal, or if she reports anything to us, or if anybody in her family sees something and wants us to see it, make sure we just look at that, because we definitely want to prevent infection. And then obviously we want to, or you're going to want to, give her 2 units of packed red blood cells with 20 milligrams of an IV piggyback of furosemide in between the transfusions of blood. They need to be administered over a 3-hour time period at this time, so make sure to do that on your shift. Good luck, and contact me if you have any questions while on your shift, and